Radio Now 100.9's Indy Connection with Emily Metheny.
Hello, I'm Emily Metheny, your host. The first 7 days of June are recognized as CPR and AED Awareness Week, and the American Heart Association uses that time to spotlight how seconds count when someone is in cardiac arrest. American Heart Association board member Dr. Sandeep Dube joined us to talk about how everyone can do hands-only CPR and why every second counts during an emergency.
So, last week has been the CPR Cardiac Awareness Week, and we know that heart disease is the leading cause of death in U.S. And out of those cardiac deaths, more than 350,000 cardiac arrests occur in U.S. every year. And a large majority of them, 70% of them, occur in patients' homes. And unfortunately, 90% of these victims die. Less than 50% of them receive help before EMS arrives. Many people don't know what to do. So it's a very important healthcare problem. Mm-hmm. And that's what American Heart Association has been focusing on.
Mm-hmm. And as you kind of mentioned, a lot of people don't know what to do in a situation where someone's in cardiac arrest. How do people go about learning what to do in this type of emergency situation?
Yeah, so, the traditional way has been to learn CPR. There are these classes, the basic life support or BLS classes. You can enroll through American Heart Association, your local hospitals. But again, those opportunities are not available to general public. So lately, American Heart Association has been focusing what we call hands-only CPR that anybody can do without a formal training. So there's been a lot of focus recently on hands-only CPR.
And can you explain a little bit about what exactly hands-on CPR is?
So hands-only CPR, the American Heart Association has made it very simple. So there are only two steps. First step is as soon as you feel like somebody has become unconscious due to heart attack, is not responding, call 911. So ask for help. So the help is on the way. And then as soon as you make that call, you should push hard and fast on the center of the chest. So typically we advise 100 to 120 compressions per minute. So those are just basically two steps and wait for the help to arrive. During COVID, American Heart Association has added guidelines to wear a mask and lightly cover nose and mouth of the victim with a mask or piece of cloth. So we don't want to cover it completely, full mask, but just a light cover so you have a barrier between the patient and yourself. So basic two steps: ask for help, make a phone call to 911, and then start pushing hard and fast on the center of the chest. Studies have shown that hand-only CPR is as effective as the traditional CPR. It circulates the oxygen that's already in the body, and it's advised on adults or teens who are unresponsive.
Mm-hmm. And as we are in CPR and AED Awareness Week, what's the difference with the AED? Because I feel like we have a tendency to hear CPR and AED in the same sentence. How is the AED different?
So that's part of the BLS protocol. Called the basic life support. So AED is the shock, right? So you give the shock. Originally, if you had that defibrillator, those defibrillators were complex. Now these defibrillators are what we call automatic external defibrillators. So all you have to do is connect the pads and press the button, so they automatically analyze the rhythm and shock it if needed. If patient is in this irregular heartbeat that we call ventricular fibrillation. But AEDs, if the AED is available, if you are in a setting like in an airport or in an office where you have that defibrillator available, you can use it. Most of the homes will not have that option that you have the AED available. But if you have the AED available, then you connect the defibrillator patches. Basically, put one patch front, one in the back or to the side of the chest, and then just push the button, and the defibrillator does everything else.
And so if I have not had any of these basic life support classes, but there is an AED where I am at, am I able to use it? Will it help me, guide me through the process?
Yeah, if you can, that will be very helpful. So that's, if you are able to use it, that's not part of the hands-only CPR process, though. So that's not part of it. That's part of the more elaborate training.
Okay.
So hopefully, the places where they do have AED or airports or stuff like that, hopefully, there'll be a person who's been trained already. So.
Excellent.
Yeah.
So if after I learn, I get a better understanding and a better feeling of hands-only CPR, if I want to go and take a full course, where can I look for those courses? Can I use the American Red Cross?
You can look at the American Heart Association website, and they can guide you where they have the courses. There are courses going on every week someplace where you can enroll in these courses. All the healthcare networks offer these BLS courses as well. So, Community Health Network, IU, St. Vincent, St. Francis, all of them will have these courses. So they are being offered through multiple institutions as well as the American Heart Association. So it's not difficult to find a place where you can get enrolled.
Excellent. And so as I start learning more of some first aid courses, some CPR would fall right in line with that.
Yes.
Excellent. And as we get ready to move on to talking about COVID and heart impact and the impact it has on the heart, is there anything else you'd like to add about the CPR AED awareness?
The more people learn about it, the better we are. As I said, that heart disease is the most common cause of death in the United States. More people are aware. More people are trained. Even if you can do just hands-only CPR, that can save plenty of lives. And then if people are willing to go and take these BLS courses, more people we have around, the safer we are.
Mm-hmm. And then moving on into how COVID has been impacting our hearts. Can you talk a little bit about some of the problems you're seeing as we kind of go through this pandemic? What impacts have you been seeing on the heart?
Heart is the second most common organ involved by COVID, apart from the lung. So there are two issues with heart and COVID. One is that people who have pre-existing heart disease, they are more prone to either get COVID, or if they do get COVID, then to get extremely sick from COVID. That means that they have increased chance of hospitalization, going on a ventilator, and dying. And then COVID can actually directly affect the heart as well. So people who have high blood pressure, diabetes, prior cardiovascular disease, the case fatality rates are about 2 to 4 times than general population. So if you have any of these conditions, pre-existing heart conditions, you are more prone to get COVID. And then if you do get COVID, more chance of getting to the hospital, getting on a ventilator and dying. So that's number one. And then number two, COVID can directly affect the heart. So there are many kind of heart conditions that can be caused by COVID. Most common condition that COVID causes is myocarditis. So that's inflammation of the heart muscle. COVID can directly inflame the heart muscle and then weaken the heart muscle, leading to heart failure and death. There's a second mechanism of myocarditis, that's by cytokine storm. So when COVID infects the blood cells, there's these immune hormones called cytokines that are released. in very sick people, and then these hormones can then cause heart damage. So that's the most common condition and dangerous condition by COVID. If people already have pre-existing heart disease, that's plaque formation, COVID can cause plaque rupture more easily. It leads to inflammation and increased clotting. So those people who are already prone to have heart attacks due to pre-existing blockages, they can have heart attacks they are more prone to have heart attacks if they get COVID. A third condition that we see with COVID is blood clots in the lungs or pulmonary embolism. So COVID causes increased clotting that we call a hypercoagulable state. They can have blood clots, and if these blood clots go into the lungs, they affect the right side of the heart, and if it's a large blood clot burden on the lungs, then right side of the heart is unable to pump the blood, and they go into acute right heart failure and can actually die from that condition. And any of these above three conditions, damage to heart muscle and heart attacks can lead to cardiac arrhythmias or irregularity of the heart rhythm, and that can lead to its own problems. So these are the kind of cardiac issues that we have been dealing with COVID.
And are these just with long-term haul COVID patients, or are you also seeing these with people who have had it short-term?
So these are actually the short-term problems. Now, long-haul COVID is another problem. And, when we talk about long-haul COVID, these are patients who had COVID, 6 weeks or 3 months prior, have recovered from COVID, but have persistent symptoms. So they can have, cardiac or non-cardiac symptoms. They can have what we call brain fog. They can't think straight. They feel fatigued and tired. They can have persistent weakness of the heart muscle. They can have persistent shortness of breath and lung symptoms as well. So these long haulers is another completely different problem that we are seeing. Many healthcare systems are establishing these long haul COVID clinics, and we at community are also in the process of establishing a long haul COVID health clinic. So these symptoms, initially people just brush them away, but it's very similar to what we initially saw with Epstein-Barr virus. Initially it was brushed away, but then people realized it caused this chronic fatigue syndrome. So something similar looks like it's happening with COVID as well, that they recover from the initial illness, but then they have these variety of sicknesses that goes on for months, and even a year after COVID.
And if I'm someone who has some of these symptoms, or I'm feeling this extreme fatigue, what should I do to start the process to start getting some care?
Yeah, so I think you should first step is to talk to your primary care doctor. Go to your family doctor and ask them, and then they can do the initial investigation. That depends upon what kind of symptoms we have, as I described, and testing, if it's underlying lung issue that's causing it, then, then they can refer to your lung doctor. Or if it's a persistent weakness of the heart muscle, a cardiologist can then follow up with you. Surprisingly, many patients who had these long haul symptoms, once they got the vaccine, some of these symptoms went away. So we don't know the mechanism why this is happening, but vaccine seems not only preventative, but also a cure for some of these symptoms.
That's amazing.
Yeah.
So this is something I should be talking with my primary care doctor about, especially because if that vaccine can help alleviate some of this, that would be the place to start, right?
Yeah.
Excellent. And at what point should people be going to their primary care physicians? If they have any concerns, should they wait for symptoms to start appearing, or could they start that conversation now?
So I think if you had COVID, even very mild symptoms, it's not a bad idea to have that conversation with your primary care doctor, and at least have one visit, in the office. If your symptoms were severe, you would be in the hospital, but if they were mild, that you didn't need to go to the hospital, then once you recover, you should make an appointment with your primary care physician, at least see them once and get a complete, thorough checkup.
Mm-hmm. And before we move on, is there anything else you'd like to mention or reiterate about COVID when it comes to heart?
So one consistent message that I would like to convey is, we don't have any particular special drug that is antiviral drug once you get the disease to treat it. So prevention is much bigger than cure. So everybody should get vaccinated. Vaccination is the key. So not only vaccination, but rapid vaccination, not only in the United States, but everywhere in the world. And the reason being that because of the variants, even if you had the disease, doesn't mean you can't get it again. These variants continue to arise in different parts of the world, for variants to form, they need to transfer from one person to another. So transmission is the fire that keeps this alive, and the more they get transmitted, the more chance of mutations and these variants to happen. So we need to douse this fire, and we need to prevent this virus from going one person to another, and that can only happen with vaccination. Mm-hmm. Early and complete vaccination all over the world, especially United States. We have the means, we have the vaccines. These vaccines are safe. If we can prevent that transmission and these variants won't arrive, that's the only way moving forwards for us to have a normalization of our life.
Mm-hmm. And where can people find information on the closest vaccination site to them?
So there's the Indiana.gov site. You will go in there. There's, I think, Indiana.gov site. I think COVID vaccination is pretty prominently displayed on the front page. And it will direct you, list all the sites that have the vaccination available, and you can choose a site which is close to you anywhere in the state. Perfect.
Dr. Dube, can you tell me a little bit about the when it comes to women's health specifically, the care for your heart changes throughout your life. Can you talk a little bit about why it changes like it does?
Somehow there's been this misconception that women are sort of protected from heart disease, and it's a disease of the men. But cardiovascular disease is still the number one killer of women. It claims more women's lives than all forms of cancer combined. So that's why American Heart Association has this initiative, Go Red for Women, which is nationally sponsored, also by CVS Health. That we need to focus more on heart disease and stroke in women, because still the number one killer.
Mm-hmm. So what can women do specifically to help lower their chances of getting heart disease?
So two things. One thing is, they should be aware that they can get heart attacks, other form of heart disease. They should not brush it off if they get chest pain or other symptoms. If you are in your 40s, 50s, older, if you get those symptoms, be aware you could be having a heart attack. And, call 911, seek help. Should not be brushed off. And then all the common risk factors. So heart disease, as we know, is multifactorial. So, diet, exercise, treatment of hypertension, diabetes, cholesterol, smoking prevention, all those things should be equally applicable to women as well as men. So start early, don't wait until you are in your 50s and 60s. Start early in your teens and 20s. Eat healthy, exercise regularly, so that we don't get into having heart disease once we get older.
And would this be something I would start talking to my primary care physician first about, especially if we have like a family history of it?
Absolutely, yeah. Excellent.
And you mentioned even as a teenager, that's something that you need to start looking ahead. Why is it so important to start that young?
So because, these, the plaque that forms in the arteries, that starts very early, so it starts to deposit in our arteries even amongst the teens. So that's why you need to start early, and it takes, 20, 30 years worth of plaque formation before it becomes significant. So, the guy upstairs, God or Lord or so whatever you want to call, has given us a lot more than we need. Like we have 2 kidneys, we only need 1. Similarly, we have a lot more artery than we need. And until those blockages get to about 70%, so they block about 70% of your arteries, we don't have symptoms. So we are in that reserve zone. So it takes many, many years of plaque formation, sometimes decades, before that plaque becomes a problem. And in some countries, it's like Scandinavian countries, they are very aggressive. So they, start giving drugs like statins, cholesterol-preventing drugs. If those cholesterol is high, even start them in teens. We never start them in teens in the United States, not even their 20s, until the patients are in their 30s or 40s. And they have family history, then we start them. But, some countries are very aggressive because this is a disease that takes years to develop before it actually causes a problem.
Mm-hmm. Mm-hmm. So that's why it's so important to start that conversation with your primary care doctor, to know your family history, so you can start basically yesterday and start to really plan for when you're 50, 60, and preventing as much as possible heart disease.
Yes.
And if people want to learn more about women's health, and especially about the Go Red for Women campaign, can they find that in the American Heart Association's website, or how does that work?
Yes. Please go to the American Heart Association site, and they have a lot of information on women's cardiovascular health.
Excellent. And as we start to wrap up, is there anything you want to add, or is there anything that you just want to drive home one more time?
Yeah, again, prevention is the key. So you can also do it once you get heart disease, but earlier you start taking care of your cardiovascular health, the better.
Mm-hmm. And that can start literally today?
Yes.
Excellent. Thank you so much for your time, Dr. Dube.
Thank you.
To learn more about cardiovascular health, find a CPR course near you, or listen to Staying Alive, which has the same beats per minute as the ideal rate of chest compressions for CPR. Visit the American Heart Association's website at heart.org. And if you're specifically looking for their women's initiative, visit goredforwomen.org. To find a COVID-19 vaccination site near you, you can go to rshot.in.gov or go to coronavirus.in.gov/vaccine. It will take you to the website with Indiana Gov. It will actually show you some frequently asked questions, as well as take you to where you can find a vaccination site and get registered. Thank you for listening. If you have any questions, comments, or topics you'd like to hear more about, email me at emetheny, that's EMETHENY at radio-one.com, or you can message me on Twitter at EmilyDoesVideo. Until then, have a great week.
Radio Now 100.9's Indy Connection with Emily Metheny.